Today, Wyoming became the last U.S. state to confirm at least one death caused by coronavirus. This comes more than 6 weeks after our country recorded its first COVID-19 death. Now, here at home, 671 New Yorkers died just in the past 24 hours. That brings the state's total death toll above 10,000. Now, the numbers, while still grim, appear to show this pandemic may be running out of steam, with the state's daily death toll seemingly stagnant over the last week. Now, another encouraging sign tonight. Governors Cuomo, Murphy, and Lamont are working with 4 other states toward taking the first steps to reopen our region.
News 4's Checky Beckford is standing by with a much closer look at the outbreak in New Jersey. But we'll get started tonight with team coverage and Ray Villeda live outside of the Javits Center on the west side of Manhattan. Ray.
Stephen and Natalie, between the Javits Center and the Comfort on the Hudson, 630 patients have been seen and treated. It's a relief for taxed hospitals across the city, hospitals which are starting to see a positive change.
I am going to start my shift. I walked in and they said everybody's intubated, and it looks like it's true, actually.
Inside Mount Sinai, Brooklyn, Dr. Melanie Malloy starts her day dealing with some of the sickest COVID patients.
Almost everybody is on oxygen, and almost everybody is a COVID patient.
This video provided by Mount Sinai gives you a glimpse of the hospital rooms that make up the statistics Governor Andrew Cuomo discusses daily. Today, cautious optimism. New York may have hit a plateau. ICU admissions and intubations are dropping. The number of new hospitalizations was the lowest it's been in 2 weeks.
The worst can be over, and it is over, unless we do something reckless.
This afternoon, talk of moving forward. Governor Cuomo spearheading that conversation with governors from 6 neighboring states.
That will happen essentially through a recalibration of what are essential workers.
It's the commuter corridor for us, but it's also the COVID corridor. Make sure you don't pull the trigger too early.
Another key to opening the economy, widespread testing for the virus and for the antibodies to determine who had it and who can return to work.
The only way we could have the really big supply we need on a sustainable level is if the federal government was able to do something very different to help us. But we will keep looking to see how we can help ourselves.
Meanwhile, inside city hospitals, moving forward is a day-by-day process. Dr. Malloy says the field hospitals have helped.
Some of them are going to Central Park to the hospital there. Some of them are going to our other sites, and that's really helped kind of offload from our department. But we're still full.
Full of patients, full of weary hospital staff, weary from juggling their work inside the ER and life in the epicenter of a pandemic.
I wonder how much my children suffer from me kind of giving everything at work. I am going to homeschool all day, and I work overnight.
That doctor is a mother of 3, homeschooling by day, saving lives by night. Now, the mayor and the governor both say we're not in the clear yet. Folks, we need to keep that social distance to keep that downward trend going. We're live on the west side tonight. I'm Ray Villeda, News 4, New York.
Ray, thank you. Major service changes are now in effect for NJ Transit. As of 8 o'clock tonight, trains and buses have slashed their capacity in half, and all riders are now required to wear face coverings. Those new regulations took effect just hours after the FDA granted approval for the first COVID-19 saliva test that's developed by researchers at Rutgers University. This is a new, less invasive approach that could help expand testing options and reduce risks of infection for healthcare workers.